promoted by health travelers worldwide. A little bit about myself. I am Dr. Gayatri Ghadiok and I will be your host and moderator for this session. I graduated from CMC Ludhiana and did my MD from Maulana Azad Medical College. I worked in hematology and histopathology for more than 3 decades, but then moved to administration and was part of the founding team and medical director of Fortis La Farm Delhi, India's first comprehensive facility for women's healthcare in the country. I was also the director of operations for Nova EV Fertility, where I established and operationalized 5 IVF centers. I went on to joining the WHO, the World Health Organization, where my focus was on public health, program development, and quality assurance in the Asia-Pacific region. A few years ago, as a WHO consultant, I joined hands with the Ministry of Health in Kerala to establish systems for quality blood transfusion services. In addition to healthcare, I am also the chairperson of a non-profit NGO called Rohini Ghadiok Foundation that works in the field of education, providing for underprivileged children. Given my work and areas of interest, I am particularly pleased to be collaborating with health travelers worldwide, healthcare professionals, and expert healthcare professionals to discuss relevant issues that we are faced with at this time. I would like to introduce Health Travelers Worldwide. This is an independent health advisory guiding patients through multiple treatment options and helping them find top doctors in India, having helped more than 7,000 satisfied patients. Their tagline is, "Let's get you better." And their services include air evacuation of complex and critical medical cases. I have the pleasure to introduce today's speaker, a close friend and colleague, Dr. Ashwini Kumar Setya. He is the Program Director, Department of Gastroenterology, Max Super Specialty Hospital, New Delhi. He is also a medical legal consultant and advisor and an editorial consultant for The Quint. Dr. Setya has had an excellent professional and clinical track record. He has delivered more than 250 lectures at international and national conferences, workshops, and meetings on gastroenterology, hepatology, pancreatology, GI endoscopy, medical law, and ethics. He has written chapters in 3 books and published more than 50 articles in healthcare related in the print and electronic media. He was also declared one of the best gastroenterologists in Northern India for 3 consecutive years by the Prevention magazine, an India Today publication. Today, we will be discussing a personal encounter with COVID-19, a physician's experience. Dr. Setya, who is a COVID-19 survivor himself, will share his personal experience battling the virus. I'm going to be asking him some tough but very relevant questions that many people are battling with these days. Many discussions will revolve around destigmatizing COVID-19 patients, many of whom are isolated, misunderstood, or ignored. Their recovery, mental health, the do's and don'ts, supporting corona-positive friends and family, and much more. Please ask any questions you may have on the subject, and please share them with us in the comment section. We will try and take as many as possible. Dr. Setya, over to you.
Thank you very much.
So amidst the continuous flow of negative news, despair, and anxiety, please give us a background and tell us about your recent experience with COVID-19.
First of all, thank you very much, Dr. Ghadiok and Health Travelers Worldwide for having me over for this session. I don't know whether I could call myself as COVID survivor. Yes, I was affected. And of course, I have survived, but you know, the connotation of survivor is that, okay, I've been through hell and come out of it. That was not the case. Despite being a doctor, I think, let me give you a background that, you know, doctors are worse patients because they are apprehensive more than a normal layperson because they know the worst about the disease. And the first thing that strikes you is the worst part of the disease, that this could also happen. Having said that, I have to actually give you a little story. How did I get the infection, and how did I discover that I had the infection? So it was somewhere in early April this year. I think, to be precise, it should be around 9th of April, that I had a very mild fever for just 4 hours and less than 100 degrees Fahrenheit, and I had some pain in the throat, and I asked my wife to just examine, and she said there's a pus point on the tonsil. So I said there may be some infection, and I took some Proin, and thereafter thought that it'll be over, which it was actually. And next day, on the insistence of my wife, actually I don't like taking antibiotics. I took antibiotics for 3 days. Was asymptomatic. All good, all very good. And suddenly, 5 days down the line, I get a phone call from my colleague in the hospital that one of our patients who we were treating for last about 2 months, he was there for a very severe disease with severe complications, had tested positive for COVID, and therefore we should all get tested now because we've all examined him if we were exposed to him. So that's fine. Even then, it struck me that I had probably.
Can I interrupt for a minute,
hours at
Ashwini?
that.
Can I interrupt for a minute?
Sure.
There's a lot of echo coming. Can the back-end team just help with that? Because you're not very clear at certain parts. Maybe you want to switch off your phone or something. I don't know.
The phone is off. Phone is off.
Okay.
Can you hear me now?
Yeah, I can. It's a little unclear though.
Can you hear me now?
Yeah, this is better.
Okay, I've come closer to that mic. All right.
Yeah.
So, and then, so there it was. We got tested, and they didn't give me the test result for 2 days. And I asked them why this was the case, and they said that probably they were running some batch once again for some reason. And I got this test report late in the night on the 15th of April. I remember very well. And so they gave me that report is positive. Even at that time, I was not shell-shocked or something. Let me be very honest with you. And I said, okay, dutifully, I informed the chief medical officer of our district because I'm working in Delhi but staying in CR. So the problem was that I was tested positive in Delhi, but I had to inform the chief medical officer of Noida, where I'm staying. And he said, Dr. Saab, you will have to get admitted soon. I said, all right. This was very late in the night, and he permitted me to stay for a few hours. And very early morning, I went to my own hospital, which was designated as COVID hospital by then, and I got admitted. So this was the background. And there I was incarcerated in a room, which was for next 14 days.
So when you were told about your corona positive, did you have any apprehensions? Forgetting for a minute that you're a medical doctor, so keeping that aside, what were the, did you have any anxieties, any apprehensions, any worries? Can you tell us about that?
So the first thing that crossed my mind was that I'm going away, and according to the guidelines at that particular time, in my house, my wife is there and my elderly mother is there, although different floors. My mother. But I was most worried about what if I had already infected them? What if they were my close contacts? And that was something which was bothering me because according to the guidelines, one would have had to be isolated. So if I had by chance infected them, then all three of us would have to be admitted. And there would be nobody here. Not only that, then what would happen? In fact, I was much more concerned about both of them, both these ladies, than myself. Because one thought at the back of my mind was, then I put two and two together, that I probably had a very mild symptom. And even my friends told me that you appear to be over the hump and now you should be okay. I mean, you need to be isolated, that's fine. So when I went there, and the very next day, the test for my wife was done, although it was not required at that particular time. But she, being a doctor herself, she got it done. Mercifully, she tested negative, and so did my mother, which was done the very next day. Uh, so that was something which was such a big relief. Believe me, you, Dr. Gayatri, that on that particular day, my blood pressure came down to normal, which used to be, they used to test it. It used to be at the higher limit of normal, say 140/90, but that day it came to 120/80 after I heard that. I was fine. I was fine.
So you were in the hospital for a couple of days. I mean, say 5 days. What?
Oh,
How
no, no,
did
no, no.
you?
I was in the hospital for 2 weeks. I
Oh,
was
sorry,
in the
sorry.
hospital
At
for
that
two
time,
weeks.
that time the government guidelines were you had to be admitted for a full 2 weeks. Right, you're right.
That's
So
right.
how did you? How do you didn't have any symptoms? How did you spend your time? Were your colleagues coming in to visit you?
No. So first thing is that I was not even allowed to open the door.
Okay.
So it was completely, I could then know what uh, being in a cell is. Although of course it was all, uh, they looked after me well in terms of catering, things like that. As far as anybody else visiting is concerned, only the healthcare workers, in terms of the housekeeping staff, in terms of the staff nurses, and possibly a visit by the resident doctor on that floor. That too, from a distance of the, they would come and be at the door and say, "How are you? Is there any problem?" and so on and so forth. Uh, the first thing that started coming the very next day were, I started getting calls from my acquaintances, not necessarily friends. And for next 3 days, I got calls from, on an average, about 50 to 60 of my people, my contacts, who I had been in contact 2 years prior to this, 2 months prior to this.
Including me.
And then I realized, yeah, and then I realized they started asking me, what happened? We got a call from the police station. Then I realized that this was a contact tracing, and I must compliment Delhi police as well as UP police, because this was done dual this thing, because I was staying, as I told you, in Noida, and was there, tested positive in Delhi, and was in the hospital in Delhi. So the district surveillance officer sent out the messages to all, and there were people who got calls 4 or 5 times. It got really bugged really at times, because, and they say, who's Dr. Setya and whether you know him, blah blah blah, and all those things. But I thought that was a very very good attempt at contact tracing. They probably got my number from either the Arogya Setu app, which I had downloaded, or from the service provider. Uh, they probably got that. So that was a very 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 good attempt at that. The other thing is that you asked me, how did I spend my time?
Right.
Uh, so this question was asked by my brother, who's in the US, who's also a doctor, and asked me, don't you get bored? So I told him, listen, I have conditioned my mind not to get bored. So that's a very strong statement to be made, because I don't want to be termed a yogi or something. No, not at all. But I stuck to my normal schedule, which means that whatever I used to do earlier, I started doing that. Because by God's grace, I was asymptomatic, other than small, mild problem in the throat, mild soreness in the throat. By God's grace, I was asymptomatic. So, will you believe that I walked in my room 45 minutes in the morning and 45 minutes in the evening? And in the morning, after walking, I would do about 15 minutes of pranayama. And then I had taken a book on meditation with me. And would read. Not that I used to read it earlier, but that was the first reading of the book. And that really helped me calm myself. You see, there were some times when you would think that these are the possible things you could have. And by then, I knew that it is only about 10th and 11th day when there is a sudden trough in the condition, and you may have problems. With my age, which is beyond 60, by God's grace, again, I don't have any comorbid conditions nor any factors which may make me more prone to this particular thing. I am not obese, I don't have hypertension, I don't have diabetes. So, on one hand, I was confident that I'll sail through. But on the other hand, you after all, you're a human being, and anxiety does come in between that. Okay, what would happen? But even then, I was more anxious about my family back home rather than myself, because I was okay. And so I wrote two articles in my professional journals while I was there, from my hospital bed. I wrote an article on similar lines to one of the publications I write for. That took time, and continued reading. That's about it. First 2-3 days took a lot of time on these contact phone calls.
Right.
But what I wanted to stress you was that, despite being so called sick, I would not like to be called sick at that time. I continued to walk, continued to do my exercises, continued to do my pranayama.
So maintaining your routine, and also maintaining as far as possible, given the circumstances, your healthy lifestyle, like your breathing exercises, the pranayama, and your walking and reading.
Yeah.
Right.
And reading. I had this time. I didn't sort of somehow. I've never. Fiction has not really interested me ever, and I've not been going to fiction at all. These are the things which I read. So I read, and these were very deep reading things. So that was, yeah, that's what I did. And will you believe that I would not see the TV? It was there in my room, and I would not get time to do that. And late in the evening, 15 minutes, I would see what is the COVID count, how many people are tested positive, and that's about it.
Right. So there are some questions that basically, besides the question, there's a lot of confusion. There are lots of myths. There are lots of differences in understanding, what with the news and the media. So one of the first things that someone has asked is that people who are home and they come down with mild symptoms like you had, like low-grade fever, a little bit of lethargy, some body aches, basically vague flu-like symptoms. You're a medical doctor, and at that time, you were being tested. I believe now testing, if you don't have symptoms, you can't get yourself tested. So what would you advise for people like this? What should they do?
Okay, so if people get these symptoms that you're describing, what is the illness? The first and the foremost thing is that they should don a mask while being at home, even then, straight away. Not necessary that you are at home, you should not. They should don a mask. They should maintain distance, and as far as possible, if you have the facility in your house where you can shut yourself in a room, please quarantine yourself at that particular time also, and seek medical help in terms of going to a doctor so that we know what you're suffering from. At this juncture, I would also like to tell you that there are varied presentations of COVID-19. Although the commonest are, of course, what you told, fever and little cough, little sore throat, little running, etc. What typical flu-like symptoms. But people can come only with abdominal symptoms in terms of diarrhea, in terms of pain abdomen, etc. So let them not take it very lightly. Let them just go to a doctor and find out what it is. Here, I would like to tell you why this is important. So even if you are asymptomatic, even if you're mildly symptomatic, and as the statistics show that almost 75 to 80% of the patients are symptomatic and would sail through easily, But what happens is that if you do not know that you are positive, then you are more likely to inadvertently or unwittingly or unintentionally transmit the disease to your own family member because you would not take all those precautions. If you know that, all right, you are positive, at least whatever, even if it is at home, whatever possible, you would take those precautions. So that's important. So do not ignore any one of these symptoms. That is what my request to every one of you would be. There is another thing which would in any case take you to the hospital, because there are varied presentations in Bombay. There have been reports, and even in other parts of the country, that there are young strokes that are coming. People 30s, in their 40s, they're falling victim to this, and they're coming down with stroke. So that is something which is very, very emergent condition. So in any case, you would go. What I am stressing on is that even lighter symptoms, at least take an advice. At least go to a doctor.
But people are scared of going to hospitals nowadays because there are lots of other patients. So many of them have, they have these symptoms, they call up the chemist, and there have been cases where they start self-medicating. I know of people who are doing that. For example, they read in the media, they hear on the media about hydroxychloroquine. So do you think that's advisable? Who should take that? Who should not? What should they do? Because people are doing that.
Dr. Ghadiok, it is very unfortunate that in India, not only for COVID, you can go to the chemist for any disease.
Yeah.
And even without the disease, you can ask for the medicine and it will be given that medicine, including antibiotics, which unfortunately has led to emergence of superbugs in this country. Right. So that is very unfortunate. But from the patient's viewpoint, again, my request is this is not the right practice. Number one, we do not know whether there is any drug which is effective. Everything is in trial phase right now. We don't even know much about the virus. Now the mechanism of the disease is also being questioned, what initially was thought after doing autopsies, etc. There is some other picture that is emerging. So especially with HCQS, there was a lot of hype about it. And there were papers on for and against using HCQS as prophylaxis as well as treatment. So as far as current status is concerned, we should stick to the guidelines of ICMR only. That Indian Council of Medical Research has issued the guidelines regarding the use of HCQS. Should not be used by everybody, and it is supposed to be used for prophylaxis, for prevention, by those people who are high risk contacts or healthcare workers who come daily in contact with them, or people high risk contacts means high risk vulnerable patients means that those who have comorbid conditions like diabetes, like, and they are beyond 65 or 60, and obesity, etc. There are fine criteria for recommending these drugs. Certainly, antibiotics like azithromycin should not be used lightly. And very importantly, both these drugs together may cause some side effects which are unacceptable. They can cause cardiac side effects. In fact, when they were giving me HCQS while in the hospital as treatment, they would do ECG because there are some arrhythmias that may come up. So it is not easy. And then suddenly what happens is that if you've taken the medicine and you go home and you suffer some kind of a cardiac problem, and then you know what to do, and you land up in the hospital without any benefit.
So basically, they should consult a physician before starting on anything.
Right. Before starting any medication, you should consult a physician.
Right.
Because you don't even know whether you have COVID.
Right.
And you see, people are just becoming apprehensive, and just on the basis of some kind of an assumption that this is COVID, that kind of thing.
Right.
So they should not do like that. I must add at this time that there are at least 70 different kind of drugs which are under trial right now for COVID. And that doesn't mean that, okay, let's say, for example, just a couple of days ago, Government of India, Ministry of Health has approved, along with ICMR, the use of remdesivir as an antiviral drug for COVID-19. But that doesn't mean that, okay, if you know that, okay, there is COVID, you go and fetch that remdesivir. Incidentally, it is not yet made available in India. They've just approved this.
Right,
And
right.
the tendency is that, okay, if the patient is very sick, you get whatever and you want to give that. I can understand the apprehension there.
So, can you tell us a little bit about the tests? There's again a lot of confusion about the tests. What are the tests that are currently being done? How accurate are they? In the middle, we had heard about the antibody tests. When will they be available? They came, they were returned, people were doing them, they were not accurate. So, a little bit more clarity about the tests, please.
Okay, so what we are doing is typically called as RT-PCR. PCR means polymerase chain reaction. It is a drug. Sorry, it is a test which tells you about the sequence of the amino acids and sequence of the chemicals that are there, which form the RNA of the virus. What we measure is the RNA of the virus. And it is a unique sequence. That is why it is picked up, and it is called as a PCR. And that is when we know that the virus has been picked up. The sensitivity of this test is not very much. It is 63%, which means that for every 100 cases, you are likely to, I'm not saying you would, you are likely to miss 37. So that is why even when they discharge the patient from the hospital, they would like to have 2 consecutive tests negative. So that is what this is done, and this is not done on blood. This is done on a throat swab and a nasal swab, which they take, and on the mucus, they uh, they test this virus, which lodges in these pharynx and the nasopharynx. Uh, that is an added information which I must give you. There was a study in Singapore which says that even when after about 11 days, if you test positive, then it doesn't necessarily mean that you're infective then, because the PCR picks up the sequence, the viral, it may not be a complete virion, it may be just that sequence of RNA, which means that it may not be a complete virus, but and therefore it ceases to be infective to others.
But the test is
Right?
positive.
But the test is positive, and this is what is
Okay.
called as viral litter. This is what is
Right.
called as viral litter. Also, there have been reports that the virus is excreted in the stools also, and it continues to be excreted much after the throat turns negative. While there are not many confirmed reports of fecal transmission, but the test remains positive. This is what we pick up on the virus. This is what we pick up on the viral RNA by PCR. There is another test, which is the antibody test. Antibody test is not supposed to be used as diagnostic test, because the antibodies are formed after your body is exposed to the virus after about between 10 to 17 days. The antibodies start forming, and there are 2 kinds of antibodies. One is the one which is called as IgM, which comes up sooner and gives you that the patient has had an acute infection. The other antibody is IgG, which tells you that, okay, you've been infected in the past, and this is a footprint. Now, what do I mean by footprint? For example, if it is raining outside and somebody comes in your house because the door is open and doesn't find you in the room where he comes, but he goes back, his footprints are there, which means the virus came in. Not necessarily it is still there, but their mark is there. So that is what antibody does. Therefore, it should be used as surveillance in the general population, as an epidemiological study, that what percentage of population has already been exposed to the virus. Another added thing here, which is important to understand, is whether these antibodies are protective. For example, in another virus, which is hepatitis B virus, when the body forms the patient's body forms the antibodies, they are protective in nature, right? It protects you from a further attack. Similarly, hepatitis A also. But in this particular case, we are not very sure whether the antibodies formed are really neutralizing antibody and they will protect. There is some indication that these antibodies may be protective because some cases wherein as a last ditch effort, as a salvage, people were given what is called as convalescent plasma, which is supposed to be rich in these antibodies. And some people have shown good results. Again, because these studies need to be duplicated, there are results which are for and against this, but so far we have seen some good results also. I cannot tell you with certainty that this is going to be effective. All I'm saying is that there may be some neutralizing effect of these antibodies. So this particular test should be done only as a surveillance. These test kits were imported from China, and earlier on Spain had rejected because these test kits were found to be very of abysmal quality. And then these were released in Rajasthan, and they also found that the only 3% accuracy was there, which was nonsense. So they have been returned. But I'm very happy to say that India has developed these kits, and National Institute of Virology Pune has developed these kits, and the final delivery has been done by a lady who delivered a baby soon after delivering this kit.
Yes, we read about it.
That was fantastic. That was fantastic. So, and these have been now have been marketed, have been made available. I think the only one last step is remaining, and that is they have reached the hospitals also where they're supposed to be used. I think validation, the final validation by ICMR, whether these kits can be used, is under process. Should be in a day or two. If my information may be a little old, may have already started.
Okay. So now you were infected. Do you have lifelong immunity, or can you be reinfected?
Okay, so there have been some patients in Wuhan who were tested positive again after being testing negative. In fact, in my own hospital right now here, a technician has tested positive again after being negative.
Okay.
But as I mentioned earlier, these were found, and these RNAs which were tested by PCR is a part of viral litter, and they do not infect people again. So as at the level of current knowledge, at the level of current information we have, I think it is unlikely. I am not even using the word highly unlikely. It is unlikely that the patient may get reinfected. As far as lifelong immunity is concerned, we don't know because this virus is so new.
Right.
For how long we have done that, and the antibody which I talked about, I do not know whether they are neutralizing antibody. Research is going on towards that direction.
Right. So, what about the current guidelines for quarantine for positive cases, on contacts, on suspected cases, and then so what should people do when they know that they have been in contact with somebody who tested positive?
Dr. Ghadiok, you've asked me a very a question which has got a very complicated and a complex answer.
You have all the time.
Why I'm saying this, I know, but it is not going to be a long answer. It's going to be a very short answer. The reason for that is that as of 29th of May, which means just about a week ago, there were 731 government guidelines / notifications on this. 731 of various central government and various ministries, ICMR, states themselves, then districts, etc., etc. And the guidelines being used in a particular area depended on the administrator of that area, the way he interpreted it. I'm sorry, I'm just giving you my example. For example, when I came back uh, after 14 days of incarceration in the hospital, I was made to remain in quarantine for another 14 days. So was my wife, who tested positive twice in the same duration, right?
Tested
And
positive?
they had I'm terribly sorry. Tested negative twice. Tested negative. I'm terribly sorry. Tested negative twice.
Yeah.
And you see, the police had put in barricades right in front of my house. They would not let us out at all. My whole sector was declared as containment zone. I don't know whether just because of my case or others' case. So it is something that and thereafter also they wanted us to have a written note from the district magistrate to show the policeman, because they say unless there is a written order they would not remove it, despite being in for 34 days, 35 days, nowhere is written. And just by the way, on the penultimate day, just a day before, when I was supposed to have been discharged after my second test negative, my first test had become negative already. The new guidelines had already come into force that if you are mildly symptomatic or asymptomatic, you may just do home quarantine for 14
Yeah.
days.
Right.
Despite that, they continued. So what I'm trying to say is that there's so much of confusion regarding quarantine, regarding isolation, etc., that it is unbelievable, and it is putting people to a lot of discomfort, lot of inconvenience, etc. Coming to the testing, I think less said the better. All over the world, it is a given that you need to test. Only then you will find who are positive, who are negative. Only then you would be able to make your combating strategies with them. And because of some reasons, there are conflicting guidelines that have been sent. As of yesterday, most private labs have been asked not to do this test. I do not know what the reason is. See, because the fact is that, if you're not testing, there are unsuspected patients who eventually test positive. They are not only transmitting infection to their close contacts at home, but also in their neighborhood. Number one. Number two, if they're coming to the doctors, then the doctors are exposed. And believe me, the doctors in all over the country are probably the largest subset of people who have tested positive,
Yes.
because they are fighting them. And there are many doctors, many of our colleagues who've died, many of staff nurses have died, many of technicians have died. This is something which can be avoided just by doing this. And now there's no dearth of testing kits. I could understand it right in the beginning when we had to face this and there were less number of tests. I think also, let me tell you that the current guidelines do not entertain other symptoms. Current guidelines to do the testing do not entertain other ways by which COVID can present. So, for example, if patient presents with young stroke because of COVID, and you are not supposed to test him, how would you know whether he died of COVID or what? Similarly, there are abdominal symptoms I alluded to earlier. I'm a gastroenterologist, patient comes to me with abdominal symptoms, and at the back of my mind, there is something that is possible that patient may be having COVID, but I'm not allowed to test. I'm not allowed to even requisition that.
Even
And
if the patient's in the
thereby,
hospital, even if the patient's admitted under you in the hospital?
so that is the hospital policy. Again,
Okay.
you have to justify why you're doing this. Earlier on, we could do it. With the current guidelines, we have to justify why are we doing it.
So why do you
And
think
if
that
they
this
fall,
this why do you think there's this flip-flop between testing, allowing or not allowing? Is it, is it availability of tests? Is it the accuracy? Is it the cost? What is the reason?
no. So see, as far as the cost is concerned, the government labs are open, the private labs are open. People are going, people are being refused. So cost is not an issue,
Okay.
right? And there are labs which have shown a very, if not high, a substantial number of people have tested positive there. I do not know whether the government wants to avoid panic that okay, there's so much of positivity, and that is why the numbers should go up. I don't know. I'm not commenting on that. But what I'm saying is indirectly we are harming more than what we are benefiting by doing less tests. So it should be done. To my mind, it should be done. And various experts have also said the same thing. Epidemiologists have said the same thing. The evidence from other countries like US, Europe, Spain, UK, everybody, the testing is something which is done. Initially, when these countries were kind of overwhelmed with with the number of patients they had. They said, okay, stay at home. We'll not even test, possibly because the testing was the number of kits available were, there was a disparity. Number of kits available were less. But I'm talking of today that in India there is no dearth of kits. Kits are there.
Mhm. Interesting. So now, there's a lot of conflicting messages that we read about, we hear on television, and also by word of mouth. People share their experiences. And so, what is your overall advice on how you should deal with this virus? I mean, how does one maintain their well-being, their wellness in this time, and what strategies can be adopted to maintain a positive frame of mind for
Right. So
people
you've
who?
given the answer. You've given the answer, Dr. Gayatri. That you have to have a very positive attitude, positive frame of mind.
That's very easy to
And
say. It's difficult to do.
right. So sure, I understand your point. And that time, if, as I said, if you stick to your original timetable, physical condition permitting you, that will help you do that. It will distract your mind from constantly thinking about the disease apprehension, etc. Constantly thinking about your body. And if you could do that, if you could do the various yogasans or physical exercise and pranayam, and then go on to meditation, whatever you may consider it to be,
Right.
right? And think positive that okay, I am determined to get out of it. I would like to add one more thing here. Not some people may or may not subscribe to my viewpoint, and that is that I had unshakable faith in a supreme power, and and a trust that I would get better come what may. I had that, right? And sharing with you and through you with your audiences, I do not know at that particular time. I felt that there was a presence of a force around me, and that made me really calm. Having said that, uh, I think this is true for many. If we have that positive frame of mind, it is now proven beyond doubt that there is something called as there is a book written by Bruce Lipton called as Biology of Belief. Belief
Yes.
changes, epigenetics come into force, right? So belief changes, and you can come out of this dreaded problem, or any problem for that matter, if you maintain a positive frame of mind.
There's a question that's come in from one of our viewers. After recovering from corona, did you feel any stigma or did anyone avoid you?
I'm very glad this question has been asked, because otherwise, towards the end, I would have told you that what pained me most during my stay there was the treatment meted out to my employees who were staying much away from me. People, the Resident Welfare Association did not let them enter in their house unless they showed them a negative report, without realizing what a negative report at what particular time is required, or whether or not it is required. They were hounded out of the house. And a stigma was in terms of the social media spread a message that I was taken away in an ambulance with the police escort. The fact remained that I drove my own car because I was okay. I drove into the hospital and I drove back in my own car after 14 days. So a lot of rumors and a lot of this stigmatization has done incalculable harm, and that pained
Yeah.
me most. People, a mainstream TV channel came in front of my house and clinic. There is a clinic there also, and made a video out of it, which was broadcast, identifying me. You see, this breaks this violates the confidentiality clause which you have for any disease, and it violates the privacy, and that's a fundamental right.
Right.
So not only that, you see, if you stigmatize and you look down upon, and people don't come to you, they don't talk to you, I think that is something which is very painful. So this is what happened with me. Now, how could you do it? I think we could do it. I could utilize your portal to do this, that we could educate the people regarding this. That is no stigma. So, for example, 20, 30 years ago, we won over the stigma as far as HIV is concerned.
Right.
People are not bothered about
It was
HIV.
not now, but it
It
was
took
a
a
big
while.
stigma at that time. Yes.
It was a big stigma, but we could educate the people, right? So I think we could educate the people that this is a disease which is highly contagious, fine. But at the same time, most of the patients are asymptomatic or mildly symptomatic. Mortality rate is extremely low, so don't worry about this. And you look after yourself, it will be fine.
Right. Right. So it is a positive message, and we have to
It is a
raise the
positive.
raise the awareness in the community.
Yeah.
So as we go
Awareness
forward,
by
can you tell
educating them.
us? Yeah, can you tell us, about community support? You've just spoken about, how you were targeted, literally targeted, and despite testing negative, not allowed to leave your house, which was against all guidelines. But can you tell us a little bit more how you see the next few months unfolding vis-a-vis Corona?
See, next few months are going to be challenging to my mind, because we can see the graph is going up as far as the cases are concerned. New cases are coming with vengeance, actually. Although we are saying that the doubling time is still about 12 to 13 days, but we are now seeing patients in lakhs. And even if saying that, okay, this is a mild disease and the mortality rate is about 3% or 2% or 4%, the absolute number of deaths is humongous, because India is a hugely populous country. We have a huge population. So if we have to see, then the number who get affected are going to be humongous, number one. Number two, I completely concede that lockdown cannot go on for indefinite period of time. Right now, we are having a fight between life and livelihood, because economy is going down, and for nobody's fault. But these are the circumstances which were thrown. So what I have to say is that we have to we have to take steps with extreme caution, and to the extent of being paranoid. Even I don't mind that. Let's say there's a paranoia, you touch something and you say let me out, and it doesn't matter. That'll make you safer, right? And maintaining distances, and also I think there is a lot to be said in favor of keeping yourself fit, keeping yourself healthy by consuming healthy, nutritious diet. And in as far as these are concerned, I think there are studies wherein if you say that if you have curcumin in the form of haldi, that is an anti-inflammatory. It was shown in the time of, I think it was in the time of SARS, that it neutralizes the cytokine storm, which is the inflammatory response to the virus, which causes the further end stage things. The so it reduces that. And certainly, if you know that, okay, there is no harm in taking tulsi or along with that some ginger, because these are the normal things with honey, that's great, because at least you are very sure that it is not a drug which can give you a side effect, right? If taken in the quantities which have been suggested for normal daily allowance, these things really help. I think positive frame of mind, of course, does help. As far as
Yeah.
the community support is concerned, I think that is going to come only and only when most of them are aware and most of them are educated enough for this to say. So I see that the cases are going to be more, but at the same time, possibly herd immunity would also grow.
Yeah, that's one thing we didn't discuss about herd immunity. So, what percentage of the population would have to be positive for herd immunity to be active?
According to one epidemiologist, the ballpark figure is about 60%.
Okay. Okay.
So that would possibly cause that.
And what are your thoughts on the vaccine?
My See, there are many people who've thrown their hat in the ring. We still there have been claims that they've developed in Oxford and their human trials have gone on and they've been successful phase 3 trials and they're going to produce it. And they were supposed to have started the final. Even the phase 3 is a pretty long this thing time, and they predicted that by November December there may be the first batch of vaccine which may be available. But we don't know. They have been challenged on this, whether the vaccine is going to be effective or not, because we still do not know what the nature of the virus is and whether even the viral infection itself is going to provide you lifelong immunity, as we discussed earlier.
Right. So would you take the vaccine, or do you need to take the vaccine yourself?
I would like to think that I am immune at least for some time.
Okay.
I would like to think that, and I'd like to believe that actually.
Mm-hmm. Okay. So is there anything there was one question that came up. What is the role of the asymptomatic people in spreading the virus? So I think we discussed that a little bit.
See, asymptomatic people are kind of a moving bomb, if I may say so. Why I don't want to use the word bomb is because that the connotation is again very severe. But asymptomatic patients supposedly have low viral load, supposedly. But I was asymptomatic. I had a very high viral load. I tested positive 5 times during my stay, right? And even the final test was before they both 2 tests came negative was borderline positive. So despite being that despite being high viral load, I was there uh, with asymptomatic or mildly symptomatic condition. There would be people. Why I'm using this term is that high viral load people are likely to transmit, one patient are likely to transmit the disease to about 6.85 people. On the other hand, a low viral load person can transmit disease to one person at given time, or maybe maximum 2, right? Uh, as far as the asymptomatic patient would not present himself to a doctor for anything, and he's carrying that virus. So unwittingly, he is transmitting infection because he would not be as careful. Even if if you know that okay, one is suffering from the virus disease and he's carrying the virus, he would like to go wash his hand very frequently, more frequently. When you're okay, it's in the routine, normal routine, you tend to miss out on certain things. That is why you are more likely to spread the virus. So they are, and since 80% of the people are either asymptomatic or mildly symptomatic, which can be ignored. So imagine the cohort of people who can transmit the disease to so many people, and that is why the new cases are coming.
But that's why even more important to, to do frequent hand washing with soap and to keep social distancing.
I couldn't agree with you more. Hand washing with soap, and just by the way, 20 seconds washing with soap is more effective or preferable to even sanitizing with alcohol-based sanitizers that
Right.
are available. They're more convenient, that's fine, and they can be used easily well because they're table, that's okay. But say, for example, I'm a doctor uh, and somebody who's seeing a patient, I would like to wash my hands twice before, after, in between, if I touch something, etc., etc.
Right, right. So, we are now near the end of our session. We've been there for nearly 55 minutes. But I just like to, put a few of the important things that you said, just highlight them. And one that was my take home message was to maintain a healthy lifestyle. So that could be in the
Absolutely.
form of physical exercise, your mental exercise like meditation, reading, whatever your routine is, maintain your routine. If you feel ill, if you feel sick, if you feel there are some symptoms, everyone knows their bodies, consult a doctor, consult your physician,
Correct.
and do not take medicines off the counter. Call up the chemist and take medicines off the counter. And follow the ICMR guidelines for testing and for quarantine, and be as careful as possible. So even if you are asymptomatic, you could still be a spreader. So maintain social distancing, hand washing, wearing a mask when you go out. And is there anything else that we've missed? And I think the news is not as gloomy and as dark as people are, the fear factor is very high. But like you assured us, it is a very infectious virus. The deaths are low. We have our infrastructure in place in our country, and we just have to be more responsible.
We just have to be more responsible. And on a very positive note, I think India has done wonderfully well as far as compared to other countries. Uh, Considering the population that we
Yeah.
have had low number of cases, we have had low death, low mortality, etc. So we've had positives of this, and we have we have kind of we have risen up to the challenge that was thrown by this. I hope we can continue to do that in the coming months also, because this faltering economy is another challenge that we have to face now. And you can't go on for just keeping lockdown for indefinite period of time. And so therefore my take home message would be that when now that lockdown is open, we have to be extremely cautious, take all the precautions. To the extent of being paranoid, I don't mind, but please wash your hand 100 times a day. Please wear the mask every time. Doesn't matter if your mother says, I can't see your face, that is important, right? And please maintain social distance. Don't go to cinema halls even when they are open, or malls or something. And if there are some malls which can actually maintain social distancing, fine, but try and do that.
Right, right. So I'd like to conclude today's live session by thanking Dr. Ashwini Setya for tackling such an important topic, and which is so relevant in our times. There's a lot of messages, coming from different sources, and answering the many questions, that I asked him. We received quite a few questions, but if there are any more that you would still, okay, I think I'm just going to. Great insight, Dr. Setya, is one comment. And somebody else has written, thank you so much for the information. And very informative and excellent. Thank you, was a very positive experience. And there's someone who's written, really sad to know about the stigma hindering the recovery of anyone, especially COVID warriors. Hats off to you, Dr. Setya, for being bold to share.
Thank you very much, and I'm humbled by your responses. All I can say is that I would request all of you who are there, not as citizens of this country, that please come and support doctors in real sense. There have been symbolic gestures are great, fine, they are necessary, but in the real sense, do not do something that has happened in Tamil Nadu, where the dead body could not be buried and so on. But let me not just go into it. We have left on a positive note. Let it be.
Yes, we have.
Thank you very much. Thank you very much, Dr. Gayatri.
So, so
and
the people
travelers
who would
worldwide.
so the people who would like to ask more questions from Dr. Setya, please get in touch with Health Travelers Worldwide on their Facebook page. And I thank Health Travelers Worldwide for initiating the Knowledge Sharing series. This is a great initiative, and I'm very pleased to be a part of it. They are also currently running a voluntary virtual clinic program with a panel of expert doctors volunteering their time to give consultations to people mostly from the northeast of India and Bhutan. So people watching from there, if you have any medical queries, please get in touch with them for a teleconsultation. The knowledge sharing series will be conducted every Saturday at 4 p.m. and we hope to engage with various experts to address relevant and important topics. I hope you will like, share, and follow the Health Travelers Worldwide Facebook page for more health-related information. Thank you very much and goodbye. Thank you, Ashwini, for your time.
Thank you.
And for your expertise.
Thank you.
Thank you.
Thank you very much. Thank you. And
Bye.
I thank Health Travelers Worldwide too. Thank you.
Thanks.